I'm Janira Rivera. Congratulations on receiving your first healthcare plan. Getting covered was a smart decision and a big step in taking care of yourself and your future. But what do you do now? In this short series, I'll share tips on how to make the most of your coverage. From understanding your policy, finding and choosing the right provider, preparing for your first visit and what to look for, understanding healthcare terms, and we'll share tips on how to live a long and healthy life. All it takes is a few minutes of your time, and I'll be here every step of the way. So click on the next video, and I'll see you there. Welcome back. Now that you have insurance, the next step is understanding it. Insurance companies offer a variety of plans, and each one works a little differently, so it's important to check with your insurance company so you know how it works and what it covers. Here are a few questions you'll want to ask. How much is my copayment? A copayment is usually a set dollar amount. For example, you might pay $10 or $20 for a doctor's visit or prescription. What is my copayment for an out-of-network provider? What portion do I have to pay for prescription drugs? Is there a limit to the number of visits for certain services, such as physical therapy or mental health? And what will a visit to the emergency room cost me? Now that you know which questions to ask, you'll want to understand the language they use. We already learned what copayment and out-of-network mean. In the next video, we'll pick up a few more. See you there. If you've ever felt overwhelmed by the terminology used in healthcare, you're not alone. In this chapter, we handpicked a few words that we think you'll find helpful. Provider. In many cases, a provider is a doctor, but it can also be another medical professional. A primary care provider is the doctor you see first for most health problems. In some situations, he may refer you to a specialist. A specialist has more training in a specific area of medicine and works with patients who have certain types of symptoms and conditions, such as diabetes or cancer. The term network or in-network refers to a group of providers that your insurance company works with. Out-of-network are the ones who don't have a contract with your insurance company. You'll pay more to use them. Whether it's in or out of network, how you pay is especially important, so pay close attention to these terms. Deductible. A deductible is the amount you pay for services before your plan begins to pay. For example, if your deductible is $1,000, you will have to pay up to $1,000 first, then they will pay the rest. Coinsurance is typically a percentage, such as 20%. It's the amount you might have to pay as your share of the cost after the deductible. Copayment is the set amount you pay up front, such as $10 or $20 for a doctor's visit or prescription, and your plan pays the rest. It's important you understand these terms. You'll definitely hear them again. And now that you speak the language, it's time for one of the most important decisions you'll make. Stay with us. As we learned in the last video, for non-life-threatening emergencies, it's good to turn to your primary care provider first and avoid visiting the emergency room. Here are some reasons why. Your primary care provider knows your medical history, so you can feel more comfortable discussing your health, asking questions, and talking about preventive care. In the emergency room, they won't know your history and will only treat your current condition. They also don't schedule follow-ups. Next, at the primary care provider, there might be a primary care copay. This could range from $5 to $30, depending on the service. In the ER, if there's a copay, it will probably cost a lot more. Finally, wait times are generally shorter at a primary care provider, plus you can schedule appointments. In the ER, you might find yourself waiting for several hours, another reason to avoid it. Now that you know the value of a primary care provider, it's time to choose one. I'll see you there. Choosing a provider is one of the most important decisions you'll make in this process. There are many to choose from, but not everyone is right for you. Here are 4 steps in finding the right provider. 1. Get the names of providers in your plan's network by going online, calling your insurance company, or looking through the policy handbook. 2. Ask around. Sometimes you can even read reviews online. 3. Narrow down your choices by picking up the phone and calling. Here are some questions you'll want answered. Are they accepting new patients? What hours are they open? Do they speak my language, and will they respect my cultural and religious beliefs? Are they in a hospital? If so, which one? Is their office close to home? And finally, step 4, test them out. It might take more than one visit to know if they're right for you, but it's worth the effort. Finding a provider you feel comfortable with means you'll be more likely to visit when you need to. But don't make that call just yet. You'll want to watch the next video in our series. See you there. Welcome back. Once you've chosen a provider, the next step is scheduling your first appointment. Here's what to expect when calling. Lots of questions, such as your name, date of birth, address, social security number, and insurance information. And here are some things you'll want to say. Tell them you're a new patient. Tell them your reason for calling, such as a checkup. Let them know which provider you'd like to see. Ask for days and time that fit your schedule, including weekends. Ask them for forms you can fill out ahead of time. This will save time in the waiting room. And don't forget to inquire about their cancellation policy just in case you need to reschedule. And that should do it. Now that you have an appointment, let's get ready for it. Find out how in the next video. Hi, you're almost ready for that first visit to the providers. But before you hit the road, here's a list of things you'll want to take. A photo ID, such as a passport or driver's license. Your insurance card. Any paperwork they sent to fill out. A list of medicine you're currently taking. A list of allergies and your family's health history. Your copayment, if it applies to your plan. A list of questions and things to discuss. And finally, feel free to bring a friend for support. Now that you're ready, don't be late. Some providers charge a late fee. So let's go. Click on the next chapter and I'll see you in the waiting room. Hi, welcome to your first visit. Don't forget to check in at the front desk, have a seat, and wait for your name to be called. When talking with your provider, don't be shy. Ask plenty of questions. They're there to help. Here are a few things you can ask. How is my health? What can I do to maintain or improve it? Do I need a test, such as blood work? If so, where do I go? And when will I have the results? If you have a health condition, ask what will happen if I don't treat it. If your doctor prescribes medication, ask what it's for and when it should be taken. Are there any side effects? Also, feel free to ask when you should schedule your next visit. And finally, and most important, don't leave the office until you understand your health. That does it for your first visit. In the next chapter, we'll help you decide if that provider was right for you. Your health is a personal matter, so you should feel comfortable with your provider. Here are a few things to consider. Did they answer your questions? Were you able to communicate and understand each other clearly? Did they listen to your concerns? Did you feel comfortable with the office and staff? Would you feel comfortable returning? If you answered no to any of these questions, then ask yourself this: what did you dislike? They didn't understand your needs. They didn't understand your questions. They didn't speak to you in a way you understood. They didn't understand your family or cultural background. They didn't have a translator. Or the office was just too far away. Whatever the case, if you're not comfortable with your provider, it's okay to look for another. And when you do find one, where do you go from there? Click on the next video to find out. There is no substitute for a healthy lifestyle, so it's important to follow your provider's advice. Here are some common excuses people make when falling off track. I forgot. If you need a reminder, stick it on the fridge or calendar, or use a smartphone app. I'm not sure what to do. That should never hold you back. Ask your provider. Don't be shy. I'm too busy. Everyone has things they'd rather be doing. But you have to take care of yourself if you want to continue doing them. Check to see if you can visit after hours or on the weekend. I don't have money. There might be some ways to lower the cost. Ask about cheaper medications and available assistance. I'm scared. Many people are. No one likes the thought of getting bad news. But remember, by getting a checkup, you might catch an illness before it worsens or prevent one from occurring. And finally, keep in touch with your provider. They are a wealth of knowledge and no one knows your health better than them, so take advantage of that. And take advantage of the next video in our series. I have a few more tips before we say goodbye. Getting health coverage was one of the most important decisions you could make in protecting your mind and body. As the series comes to a close, we at the Centers for Medicare and Medicaid Services thank you for taking the time to put your health first. But before we go, I think it's fitting to share a few more tips. Make time for exercise. Even a short walk is better for your health than nothing at all. Remember to relax. It's a great way to de-stress. Get regular checkups. That's the best way to stay healthy and ahead of any unwanted surprises. And finally, take an active role in your health. Watching these videos was one step. Now continue to seek out other ways to live a healthier lifestyle. For more information on the topics we discussed, you can also log on to our website day or night at the address on your screen. Thanks again for joining us. We hope you found these videos helpful. For everyone at the Centers for Medicare and Medicaid Services, I'm Janira Rivera. Take care.